Kidney disease is a significant health problem affecting millions of people worldwide. And as a chronic condition, it sometimes leads to severe complications, including kidney failure. Many people with kidney disease seek ways to manage or potentially reverse their condition, and fasting has emerged as a potential remedy. But does fasting help reverse kidney disease, or is it just another myth? In this video, we'll explore the relationship between fasting and kidney disease. By the end of the video, you will have a clearer understanding of whether fasting to reverse kidney disease is a myth or a fact. So, keep watching. First, let's discuss the role of the kidneys in the body. Before talking about fasting, understanding the role of the kidneys in the body is very important. The kidneys are two bean-shaped organs that are located on either side of the spine, right beneath the rib cage. They filter waste, regulate fluids and electrolytes, and maintain blood pressure. They also produce hormones that help regulate red blood cell formation and bone health. However, sometimes kidneys become damaged and can no longer perform their functions properly, which causes kidney disease. Hypertension, diabetes, and glomerulonephritis, the inflammation of the glomeruli or the small blood vessels in the kidneys, are the main reasons for kidney disease. Moreover, infections and some medicines can also increase the risk of developing kidney disease. Now let's discuss the stages of kidney disease. The severity of kidney disease is typically classified into 5 stages, which are determined by the glomerular filtration rate, or GFR, a measure of how well the kidneys filter blood. In stage 1, there is some kidney damage, but the GFR remains normal or slightly high at 90 or above. Stage 2 represents a mild reduction in kidney function, with a GFR ranging from 60 to 89. By stage 3, the kidneys experience a moderate decline in function, with the GFR falling between 30 and 59. In stage 4, there is a severe reduction in kidney function, and the GFR drops to between 15 and 29. Finally, stage 5 indicates kidney failure, where the GFR falls below 15, and it often requires treatments like dialysis or a kidney transplant. Kidney disease generally progresses slowly and takes years to reach the more advanced stages. However, once the kidneys are significantly damaged, the condition can become life-threatening and require urgent medical attention to manage the complications. Now let's understand fasting and its different forms. Fasting is the practice of voluntarily abstaining from food and sometimes drinks for a set time. For generations, it has been practiced for religious, spiritual, and medicinal purposes. Recently, fasting has gained attention for its potential benefits in managing obesity, diabetes, kidney disease, and cardiovascular disease. There are various ways to fast, with different durations for each. The most common form is intermittent fasting, which involves alternating cycles of eating and fasting. Popular methods include the 16-by-8 approach, where individuals fast for 16 hours and eat during an 8-hour window, and the ratio of 5-to-2 method, where people normally eat for 5 days and restrict calorie intake to 500 to 600 calories on 2 non-consecutive days. Another method is Eat-Stop-Eat, which involves fasting for 24 hours once or twice a week. Time-restricted feeding is another approach, where all meals are consumed within a specific time window each day, usually between 6 and 12 hours. Prolonged fasting involves abstaining from food and drinks for extended periods, typically 24 to 72 hours or more, but this should be done under medical supervision. Moreover, alternate day fasting, where individuals alternate between days of regular eating and fasting or reduced calorie intake, is another less common approach. Now, let's explore the science behind fasting and kidney health, along with its potential benefits. The idea that fasting supports kidney health and helps manage and reverse kidney disease is based on the metabolic changes that occur during periods of food deprivation. When the body is deprived of food, it undergoes physiological changes, including changes in energy metabolism, hormone regulation, and cellular repair processes. These changes are thought to influence kidney health in several ways. First, fasting is thought to reduce oxidative stress and chronic inflammation, both of which contribute to kidney damage and disease progression. By increasing the production of antioxidants and reducing the activity of pro-inflammatory cytokines, fasting can help heal kidneys and protect them from further damage. Second, fasting can also improve insulin sensitivity and help regulate blood sugar levels, the main risk factors for kidneys. This is because lowered blood sugar levels ease the strain on the kidneys and allows them to function more effectively. This is especially important for preventing kidney damage in individuals with diabetes. Another potential benefit of fasting is the activation of autophagy, a natural process that removes damaged cells and helps repair and regenerate tissues. In the early stages of kidney disease, autophagy may help repair some kidney damage. Additionally, fasting can promote weight loss and better blood pressure control, both of which are critical for maintaining kidney health. Reducing weight and blood pressure can decrease the strain on the kidneys and may slow disease progression. Some research suggests that fasting can improve kidney function and even raise the glomerular filtration rate in individuals with kidney disease. This improvement could be due to reduced metabolic stress on the kidneys, allowing them time to recover and perform more efficiently. Supporters of fasting believe it can benefit the kidneys, particularly in the early stages of kidney disease. While fasting can have many kidney health benefits, it is not without risks. So, let's understand the potential risks of fasting for kidney disease. As mentioned earlier, the kidneys help maintain the body's fluid and chemical balance, and fasting can disrupt this balance, which can cause problems. One major concern is dehydration, which is particularly risky for people with kidney disease. This is because the kidneys need enough hydration to function properly. When the body lacks sufficient fluids, it can degrade kidney function and even lead to the formation of kidney stones, as concentrated urine promotes stone development. Since the kidneys help control the body's fluid levels, those with damaged kidney function can struggle to stay hydrated. Water fasting, in particular, can increase the risk of dehydration, which is dangerous for people with chronic kidney disease. Another risk is the imbalance of electrolytes like sodium, potassium, and calcium. Fasting can change the levels of these important minerals, which can be harmful to people with chronic kidney disease, as their kidneys already have trouble maintaining balance. Extended fasting or fasting without fluids can also increase the risk of acute kidney injury, or AKI, a sudden and serious drop in kidney function. AKI can cause permanent kidney damage or even be life-threatening if not treated promptly. Fasting can also cause a buildup of waste in the blood. When fasting, the body breaks down fat and muscle for energy, producing waste products like urea and creatinine. In people with chronic kidney disease, the kidneys may not filter these wastes efficiently, leading to uremia, which can cause nausea, fatigue, and confusion. Fasting can also affect blood pressure. While it can lower blood pressure, it can sometimes cause dangerously low levels, especially in chronic kidney disease patients who are already at risk or on blood pressure medications. Although some studies suggest fasting can benefit kidney health, the long-term effects on kidney function and disease progression are still unclear. Most research on fasting and kidney health has been done on animals or small groups of people with short follow-up periods. More long-term studies are needed to fully understand the safety and effectiveness of fasting as a treatment for kidney disease. So, is fasting for kidney health a myth or fact? The question of whether fasting can reverse kidney disease is complex and sensitive. While there is some evidence that fasting can benefit kidney health, it is essential to consider the potential risks carefully. Several factors influence how fasting affects kidney health, including the type and stage of kidney disease, as well as the individual's overall health. For some individuals with kidney disease, fasting might help manage their condition, particularly in the early stages. However, for others, the risks could outweigh the possible benefits, and alternative changes to their diet and lifestyle may be more effective. In general, fasting can provide some benefits for kidney health, but it is not a guaranteed method to reverse kidney disease. More research is needed to understand how fasting impacts kidney function and disease progression over time. For now, individuals should approach fasting cautiously and consult a healthcare professional before starting. As with any treatment, finding a balance that maximizes benefits while minimizing risks is crucial. Implementing safe fasting practices. If a doctor approves fasting, it is vital to approach it cautiously. Monitoring kidney function during fasting is crucial to minimizing risks. Safe fasting practices include staying well hydrated, consuming small amounts of food during fasting periods, or limiting fasting to shorter intervals. For example, intermittent fasting, which involves cycling between eating and fasting, can be a safer option than prolonged fasting. Additionally, patients with kidney disease should follow a kidney-friendly diet even while fasting. This includes focusing on foods that support kidney function and avoiding those that may exacerbate their condition. Maintaining a balanced diet rich in essential nutrients while being mindful of sodium, potassium, and phosphorus intake is critical. These dietary adjustments can help manage kidney disease more effectively alongside any fasting practices. Moreover, let's discuss some tips for safe fasting. Number 1. Consult a healthcare professional. Always start by consulting a healthcare provider to determine if fasting is suitable for your specific situation, particularly if you have underlying health conditions. Number 2. Stay hydrated. Ensure adequate fluid intake, especially if fasting for longer periods. Consider drinking water, herbal teas, or low-sodium broth to maintain hydration without overloading the kidneys. Number 3. Gradual introduction. If you are new to fasting, start slowly. Gradually increase fasting intervals to allow your body to adapt, which can help reduce any potential side effects. Number 4. Monitor symptoms. Keep a close eye on how you feel during fasting periods. Symptoms like dizziness, fatigue, or weakness should be addressed immediately, and fasting should be halted if these symptoms persist. Number 5. Plan your meals. When you are not fasting, prioritize nutrient-dense, kidney-friendly foods that are low in sodium, potassium, and phosphorus. Planning meals can help ensure you meet your dietary needs without compromising kidney health. Number 6. Consider shorter fasts. If extended fasting is too challenging or poses risks, consider shorter fasting periods or time-restricted eating, which allows for daily food intake within a limited window. Number 7. Keep track of kidney function. Regularly check kidney function through blood tests and consultations with your healthcare provider to ensure that fasting is not adversely affecting your kidneys. It is important to understand diet's role in kidney disease management. This will also help in fasting effectively. Diet plays a crucial role in managing kidney disease. Patients are often advised to adopt a kidney-friendly diet to minimize further damage and protect their remaining kidney function. This typically involves reducing the intake of sodium, potassium, and phosphorus. Sodium is commonly found in salt and processed foods, and excessive sodium consumption can lead to high blood pressure, a significant risk factor for kidney disease. For individuals with chronic kidney disease, a low-sodium diet can help regulate blood pressure and support kidney health. Potassium is another essential mineral that must be monitored carefully. Many CKD patients struggle to excrete potassium, leading to potentially dangerous high levels in the blood, known as hyperkalemia. Foods high in potassium, such as bananas, oranges, and potatoes, may need to be limited to prevent this condition, which can cause muscle weakness and heart complications. While phosphorus is vital for bone health, excess levels can be harmful to CKD patients. As kidney function declines, phosphorus can accumulate in the blood, leading to hyperphosphatemia, which negatively impacts bone and heart health. CKD patients are often advised to limit phosphorus-rich foods, such as dairy products and certain nuts. Moreover, while protein is necessary for overall health, excessive protein intake can put additional strain on the kidneys, increasing the buildup of waste in the blood. Therefore, many healthcare providers recommend a low-protein diet for CKD patients to reduce renal workload and potentially slow disease progression. Monitoring kidney function during fasting. To safely manage kidney disease, especially when fasting, regular monitoring of kidney function is essential. Various tests can assess how well the kidneys are functioning, including blood tests for the glomerular filtration rate, blood urea nitrogen, and creatinine levels. GFR is a critical indicator of kidney health, assessing how effectively the kidneys filter blood. Low GFR levels indicate diminished kidney function. The BUN test measures the concentration of urea nitrogen in the blood, a waste product from protein metabolism. Elevated BUN levels can signify that the kidneys are not filtering waste effectively. Similarly, creatinine levels can reveal how well the kidneys are functioning. High levels suggest impaired kidney filtration. Additionally, Monitoring electrolyte levels, blood pressure, and fluid balance is crucial for individuals with kidney disease, especially during fasting. If any abnormalities arise during monitoring, adjustments to the fasting plan may be necessary to protect kidney health. Open communication with healthcare providers ensures that any required changes can be implemented promptly. So, in conclusion, fasting can serve as a complementary approach to managing kidney disease, but it should not replace standard medical treatments. A balanced approach that includes traditional methods, dietary changes, and lifestyle adjustments is essential for effectively managing kidney health. Thanks for watching. If you found this video helpful, like it and subscribe to our channel for more informative content. See you in the next video.